Let's go to Geneva, Switzerland, and speak to Dr. Emanuele Capobianco, the Chief Strategy and Impact Officer at the WHO Foundation. Welcome. We always appreciate your time, Emanuele. Are you convinced that richer countries have contributed to the creation of the Omicron variant?
Well, the rich countries have contributed at hoarding vaccines. So 80% of the vaccines that have been distributed worldwide have gone to the wealthiest country and less than 1% to the poorest countries. This is a major problem that needs to be corrected. It is a moral problem, is a problem from the epidemiological point of view, and it's also a major economic issue that needs to be addressed swiftly.
Yeah, and until that is addressed, do you expect possibly even more variants to occur? Because as we heard in that report, the lady was saying that actually if places are not immunized, then the coronavirus is going to be able to mutate. I mean, I want to give you one example before you pick up on that. One of the most infectious conditions known to humankind is measles, and apparently 90% or more of a population has to be immune for measles for it to not re-enter the community. That's a huge percentage.
Yeah, and what we need is a very high coverage to protect the global community, all of us, from COVID-19. And that high percentage of coverage means vaccinating poor countries and giving priority to bringing doses to low-income countries. And we have basically two ways. We have governments that should be financing and donating vaccines to COVAX, which is a platform, an international platform for distribution of vaccines in low-income countries. But we also have a role as citizens to play where governments don't go that far by donating vaccines through a platform that we as the WHO Foundation have set up, the Go Give One platform that allows every citizen to donate with $5 or €5 vaccines for low-income countries. So if we come together, government and citizens, we can really try to turn this terrible tide of vaccine inequity, injustice, I would like to say.
Emanuele, I know that the data still is unclear about how severe Omicron infections are and whether vaccines do provide immunity. We know that there are quite a large percentage of breakthroughs of Omicron in people who have been double vaccinated. So rather than that, what do you know about the rate at which we're going in terms of poorer countries being vaccinated? How far are we from those countries being vaccinated enough for the world to feel safe? Are we talking 2022, 2023, even further?
I'll give you a number. We were hoping to bring vaccines to 40% of the people in low-income countries by the end of December. We are around 7-8%. We are very far from that. And the goal was to bring 70% of population covered by mid next year in low-income countries. Unless we increase the distribution of vaccines in poor countries, that goals will be missed. And the global community, all of us, will remain at high risk for the emergence of new variants. So the recipe is very clear, is bringing vaccines out there as fast as we can. And it's a government's commitment from the richest countries, but it's also, as I mentioned before, an opportunity for individual citizens to contribute to gogivone.org platform to bring new vaccines into low-income countries.
Which would be fantastic, as we've been discussing. OK, at the moment, most experts say, because of the lack of data about Omicron, that the Delta variant is still the most dangerous in terms of its impact on our health. But the data from South Africa and also from here in the UK suggests where Delta was doubling in terms of infections every 2 to 3 weeks, Omicron cases are doubling every 2 to 3.5 days. Just because of the number of infections that are predicted to happen at that rate, what impact is that going to have on health systems? OK, let's imagine that not as many people need to be in ICU, not as many people need to be given oxygen compared to Delta. But because of the number of infections, what's the effect going to be?
Well, you are clearly, after a year, you're becoming a public health expert, and you know the answer. The answer is if you have a very large population being infected, even with a variant that may be milder, there will be still a very high number of cases that will be severe, that will clog hospitals and that will increase the mortality. So the response is to vaccinate people against Delta, because Delta is the variant that is prevalent around the world, but also to vaccinate to prevent Omicron. But again, the first point of entry must be low-income countries. The people that are dying are the unvaccinated ones, not the people that have had 2 vaccines. So let's bring the first vaccines to the people that are unvaccinated, and then later on, we can think about boosters.
Emanuele, as always, thank you so much indeed for sharing your expertise. It helps all of us. Emanuele Capobianco in Geneva.